Welcome to another video table of contents highlights from the editor's desk. The goal of these videos is to draw your attention to the great science published twice per month in AJP-Heart and Circ. This week, I would like to highlight 3 papers in the June 15th issue of AJP-Heart and Circ. We start with a study in our recent call for papers on cardiovascular and cerebrovascular aging. In this study by Porter et al., both in vitro and in vivo experiments point to the fact that decreased SIRT3 may increase the susceptibility of cardiac-derived cells and adult hearts to ischemia-reperfusion injury and may contribute to a greater level of IR injury in the aged heart. These experiments have implications for cardioprotection during aging. In an interesting but related paper, Lin and colleagues showed increased levels of endostatin in aging mice. This was associated with renal microvascular rarefaction. Importantly, treatment of young mice with endostatin delayed recovery from femoral artery occlusion and reduced patency of renal vessels. The findings are consistent with the hypothesis that elevation of endostatin levels and parallel microvascular rarefaction may induce renal fibrosis. We finish with one of our rapid reports, where Kozama et al. Show that Aumentin, a novel adipokine, may be protective against hypertension development by inhibiting vascular structural remodeling. These investigators demonstrated that Aumentin controls smooth muscle migration by inhibiting platelet-derived growth factor BB, thus reducing intimal hyperplasia. Thank you for joining me in another edition of Video Table of Contents Highlights. Stay tuned for the next installment and go to the AJP and Circ webpage to view all of the great papers published this week in AJP-Heart and Circ. Oh, and send us your best science as soon as you can. See you next time.